Hello, everyone. Welcome back to the BioNexus Health podcast, Autism Uprooted. Today, we are continuing with part 2 of the European Moms Q&A that was organized. And we had so many amazing questions that were asked, very useful, very informative. So just be sure to check out part 1 as well, right? Just so you have the complete picture. So part 1 and part 2 are both very pertinent and important questions that I'm sure many of you would like answers to. So today, this will be part 2 of the Q&A with Autism Moms from Europe. So let's go ahead with that.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
All right, so we are back. So let's proceed with another question you had from a mom in Germany. She had a question about IgG.
The question is, if the limit of an antibody on the lab is less than 10 and the value that's coming to the child or the adult over 500, how do we explain these values and what impact will they have on the body or organs?
Okay, so just the IgG is high. Well, the first thing I would do is look at the subclasses. Which one is high? IgG 1, 2, 3, or 4. Okay, there are many reasons for IgG to be high. Could be PANDAS, could be food sensitivities, could be both, could be leaky gut, right? Then there are definitely additional labs that need to be done. You can't base your treatment on IgG being high alone.
How does the genetic modifications, like in WEGS or on a West testing, kids are coming with modification. How do they impact the recovery of the child and the treatment that you might give? Is there, like, for example, is that child able to recover 100% or is just decreasing the chances of recovery when you've got a genetic condition?
Along with autism?
Yes.
Right. Right off the bat, no one recovers 100%. Not even my own son. All right. So it will all depend on what percentage the autism symptoms are caused by underlying issues. And when we treat the underlying issues, I typically see, in children, on an average, 70 to 80% of symptoms get better right there. So 70 to 80% of symptoms were because of the underlying comorbidities. When addressed, those healed. Now that brings you to the remaining 20%. That is where repair and regeneration comes into play, because we know that the remaining symptoms is most probably the autism, right? The real autism, not the false diagnosis that we corrected. Now, with regeneration strategies, you can recover more. So with my son, we reached on a good day, 95%. So nobody recovers 100%, but there are certainly strategies that can be used. Now, there was something in this question. What part did I not answer?
No, I think you did. With the genetic condition, what does it?
Yes. Okay, so let's go back to that. That's something that I don't think I did full justice to the genetic, right? So now, genetic issues. It could be a genetic mutation, could be a large number of genetic mutations. It could be genetic predispositions. Okay, so let's talk first about mutations and then predispositions. Mutations, there can be a lot of mutations that are identified in a special needs child. Now, just because there is a mutation, so what? Everyone has mutations. That doesn't mean that that particular mutation is the gene is expressing. So gene expression is a very important part of what we treat and what moms and dads need to understand for their autistic child, right? There are many genetic tests out there that, will map the full genome and say, oh my gosh, this is an issue. Wow, that's an issue. Yeah, sure. Research has shown that, almost 100 genes can be off track in a child with autism. That's the reason why genetic treatment option for autism failed. When they mapped the human genome, there was a large amount of hope, of course, for cancer and whatnot, but also for autism. Hey, let's see, what genes are responsible. Can we do some genetic engineering? Can we do something about it? But they found that almost 100 genes are off track in a child with autism. So then they developed testing. So parents looking for answers pay a lot of money for genetic testing. But the most important thing to understand is that there are many factors that can turn the genes off and on. Okay, your environmental toxins can affect the mitochondria. When the metabolism of the mitochondria inside your cells is affected, gene expression, what genes are turned on, what are turned off, that is affected. So, how they say that some families have whatever, genetic, let's say Huntington's disease, right? But sometimes it skips a generation. What is that? If it is genetic, it is meant to happen every time. Why does it skip a generation? That's probably because that generation did the right things, lived the right way, made the right choices. So that is one theory, and I see that theory come true, very often. Next, we are going to genetic predispositions, right? So genetic predispositions, like for example, if you see for women, the breast cancer gene, the BRCA, right? Oh, I have it. Okay, just because you have it doesn't mean that you go get bilateral mastectomy. Heck no, right? You need to investigate if you have, what is your level of toxicity and what is your risk that will express itself. So if you are predisposed, you have to understand the mechanisms of your immune system, what is happening, how to reduce the risk factors. That is the way to proceed. So if there is any genetic issues, that does not, exclude that child from being treated. That is a small part of what could be the connection with autism, a very small part.
And basically this happens as well in the syndromes as well. For example, the particular person that is asking is Christina, and she's talking about Coffin series. She's been diagnosed with the syndrome, which obviously includes many genes that are put under. So it's going to be the same.
Correct. Yes. Remember the earlier answer I had given that, children with genetic issues develop multi-system, multi-organ issues as well, simply because of what's going on genetically and what has not been addressed. If there is autism, obviously there are many things that have not been addressed. Basic biomedical treatment doesn't always address everything, especially if you're not seeing improvements with biomedical treatment. Sorry. So when it comes to syndromes, cerebral palsy, Fragile X, many of these conditions, you will see that, first of all, very sadly, the life expectancy is not great. The life expectancy is just accepted. Hey, there's this syndrome. So, I'm not going to have my child for more than 15, 20, 30 years. Why? you should absolutely do the due diligence and understand what is really going on. Don't just put blindfold on and say, hey, it's a syndrome, that's it. So I'm going to accept that I won't have my child after so many years. I would not advise that. Don't accept that.
Thank you. Another question is about a neurotypical child, puberty age, he's 14. He's got severe hormonal imbalances, also with breast tissue. And of course, this is creating loads of depressions. And the parents are asking, is there anything you can do to help him due to the fact that he's 14 and he's now going through puberty, and especially that the tissue is so advanced? Can the natural healing be something for him to look into?
Yes, absolutely. We have to look at hormonal disruptors. We have to identify endocrine disruptors for this child. And in the meantime, the one thing to stop would be stop eating fast food.
Okay.
If it's a female.
No,
right?
it's a boy. It's a boy.
A breast tissue.
Yes.
Okay, so gynecomastia in boys, then that is, yes, definitely stop eating processed food, junk food, fast food immediately.
Okay. And there is hope for him as well.
Oh, yes, absolutely.
Treatment, yeah?
Yes.
Great, thank you. Now let's go on to the adults' questions. There is Tina. She said, I'm diagnosed with borreliosis chronic and loads of co-infections. She's got, oh no, it's still a child question. She's got a four-year-old girl. She's done the testing and she's got negative IgG and IgM, but not the co-infections. So the co-infections are positives. What could switch on the Borrelia, and what can she do now before she go into the same symptoms as the mom is going through now? At the moment, the mom is doing immunity boosting treatments based on plants.
Oh no. Right. Well, if mom is doing immune boosting, it's better than, giving it to the child, I guess. But yeah.
No, the mom is giving the child immune boosting.
Oh, okay. Okay. Well, that is not a good idea. I've already explained this in an earlier question. So this IgM and IgG borreliosis negative is whose lab results, mom or child?
The girl child. The girl
child's. Okay.
Yes. Is negative for borreliosis, but is positive for co-infections.
Right. Such a thing doesn't exist. Being positive for co-infections probably came from the same source. Now, understand that Lyme disease has tropism and immune suppressive. There are many articles, research on this. So the tropism means it exists in many different forms. And lab tests are not available for all the different forms of Lyme disease, the spore form, the L form, the blebs. Now, spirochete, there are lab tests, right? So for all the forms, we don't have lab testing. Additionally, the immune suppression, Lyme disease suppresses the immune system. And where do you think IgG, IgM comes from? Your immune system. Immune system produces the IgG and IgM. So when there are co-infections, it would be negligent to assume that Lyme is negative. Lyme needs to be treated first. Co-infections can be eradicated. Okay, eradicated. Herbally, naturally, if the herbs are powerful enough, if the protocol is accurate, the co-infections can go bye-bye. But the Lyme disease can only be put into remission. Okay, and it is immune suppressive. So the first order of day is to address the Lyme disease. So, hopefully your practitioner understands that Lyme disease, the lab tests are very often false negative. Now, I don't know if a Western blot was done. Western blot in these cases will show at least a band 41 because there are already established co-infections. So it's very important to address Lyme. And no immune boosting, please.
We've got another question from Dorina. I think she's here online. She said, I'm diagnosed with chronic borreliosis and loads of co-infections. Her symptoms started 8 years ago, but she's got the diagnosis 1.5 years ago. She's been all through this year to rheumatology. She's done all kind of treatments for the autoimmune disease, polyarthritis, rheumatoid polyarthritis.
Yes.
Since she has found out that she's got borreliosis, she has stopped all the treatment for autoimmune disease and started the treatment with antibiotics. The question is it normal to feel worse after the antibiotic than before? She's got a period since she's more blocked and doesn't have any mobility, and she's walking very, very hard.
This is late stage Lyme disease, and there is always co-infections. So if only Lyme disease has, first of all, it's been identified after many years of damage already caused. So Lyme disease and co-infections have already caused damage. Lyme disease is very closely associated with autoimmune. So yes, arthritis. I was myself diagnosed with MS, some kind of inflammatory arthritis. They couldn't put their finger on it, back in the day. And chronic fatigue, fibromyalgia, depression, anxiety. Oh my gosh, it was a long list, and I was overweight because of mold toxins affecting the brain. And it was just complete nightmare. But all of those went away. Now, do you treat? Okay, no, wait, let me go back. This is very complicated, poor lady. Okay, so damage has been done. If you're doing the modern treatments for autoimmune conditions, it's just suppressive. They just suppress your immune system. They give you very toxic anti-inflammatories, which can cause a pretty bad leaky gut and gut inflammation. So that is the modern treatment, methotrexate and Humira. These are very toxic treatments. They shut down the immune system, steroids sometimes. So if you stop the treatment, well, good, in my opinion, but I don't know if it is good for your condition if you're not treating everything properly, right? So if you're not treating borreliosis correctly and co-infections, then your autoimmune conditions will continue to deteriorate. Soft tissue is attacked by Borrelia. Environmental toxins also create enzymes that attack the soft tissue. Soft tissue meaning, cartilage, joint, muscles. So I hope that answers your question. Now that you know there is borreliosis, it's a gift, meaning the knowledge is a gift, not borreliosis, obviously. The knowledge is a gift, and remember to use the knowledge properly. The universe is giving you a chance to get better. And if depending on your age, you can get really better and get rid of all of these autoimmune conditions.
The question was in regards to the antibiotics. Is it okay to feel worse after antibiotics than before when you were just treating the autoimmune disease?
Okay, so that is a die-off reaction. It doesn't matter what treatment you use to treat. Everyone goes through Herxheimer or die-off reaction. And the practitioner giving you antibiotics, treating for Lyme disease, probably has explained to you or should have explained to you what Herxheimer and die-off reactions can happen. And, there are strategies, there are techniques. You don't just go ahead and explode a grenade in somebody's body. Here, you have Lyme, do antibiotics. That's not done. The body needs to be supported first, and then you start using the antibiotics. And are antibiotics needed? No. You can do it completely naturally, but some people prefer to do antibiotics, but it needs to be done properly.
Right. Ovidio was asking on the chat if there are any news about ASLX2, and if a child with the values of CMV, which is cytomegalovirus, IgG, it's 101, HHV6, IgG positive, Epstein-Barr virus positive, IgM positive. Is this Lyme or it's PANDAS or PANDAS?
Can be both. Based on the labs, yes, it could be both.
And there is another question in regards epilepsy. For example, if a child is not sleeping comfortably during the whole night, but the crises are happening all the time between the 5 and 7 in the morning, what would be the cause, the link, what's happening with the body in that period, having to fight Lyme and epilepsy? Is there a link? Is something happening? What would be the cause of this exact time when the crises are happening?
Detoxification and brain inflammation. Lack of sleep, obviously, right? So the brain is not healing, not just the brain, the entire body heals when there is nice sleep. When there is good sleep, deep sleep, it is an absolute necessity for all of us. So even if there are broken periods, 3 hours deep sleep, then you're up. Like many children do that. Like Brian used to wake up every 2.5 hours coughing and other PANS issues, but then he would go back to sleep and sleep deep again, and so on and so forth. So sleep deprivation is a huge issue for anyone, right? More so for a child. Detoxification happens during the sleep hours. Inflammation is resolved. Healing occurs. Now, if those things are not happening, then obviously the toxicity level adds up. And, for this child, that threshold level, that trigger threshold level seems to be between 5 and 6 a.m.
Great, thank you very
And
much.
we know, oh, you're welcome. We know that Lyme, there's plenty of research that Lyme crosses the blood-brain barrier. It causes brain damage. And brain inflammation.
Definitely. I'll finish my set of questions. If there is anyone else here that would like to address a question, you're more than welcome. Just raise your hands or unmute your microphone.
Yes, yep, the floor is open if anyone has any questions. And if you need Alexandra to translate, that's fine.
Definitely.
Yeah, doesn't have to be in English.
Hi, I'm Mariana. Hi.
Hi, Mariana. How you doing?
I'm okay. So once the brain is damaged from Lyme's and co-infection, and there is a lot of symptoms and everything, there is hope we can healing the brain again to come back like before.
Yes, absolutely. Not like before. No one gets better 100%, right? But many children, the actual brain damage will heal, but not to 100%. Right? Many children, it does. I have seen the brain MRIs go back to normal. But behaviorally, physiologically, that is just, not possible. Now, remember, I explained earlier that if, for example, hypothetically speaking, 80% of autism is caused by PANS, for example, then 80% of symptoms associated with PANS will get better. There's going to be the 20% left, And those will be your, the real autism then. And those we have to address in a completely neurological and sensory integration manner, right? So there is hope there. But like I said, for my son, we were able to get up to 95%, not 100. 100%, is not going to happen for any one of us, even if it's an adult. Okay. Now, can anyone recognize that this child has issues? No. Unless there is, a physical issue. Like with Brian, we have a physical issue with the neck, but even that, it's not, if he's standing in front of you, you can't say that there's something wrong with him once he starts talking. So in that way, you can say, yes, it's back to having a normal life, right? So that I've had many children. Now, brain damage, as I mentioned earlier, brain repair and brain regeneration of neurons is entirely possible using herbal medicine.
And if this is implying tics and twitching in his face, with treatment, can we hope that this will disappear with time? At least
motor tics, right? Motor tics, yes. Some of them are because of damage, and some of them are because that it's an autoimmune condition. All right. So when we start repairing and regenerating the gut, the neurons, that's when anything that is associated with damage will get better. And the motor tics, oftentimes children have many different motor tics, and some of the motor tics are purely associated with autoimmunity. So remember, autoimmune, there's no cure for that. Anytime there is, you can't say that, okay, my son has PANDAS, all this, most of the symptoms are gone, so now I can do whatever I want. We can go in the mall, we can eat whatever, we can get mosquito bites, insect bites, nothing is going to happen. I can get strep, he can get strep. No, that doesn't work that way, right? It's an autoimmune condition. So whenever there is a trigger, you will see some symptoms coming back. Now, those symptoms will go away pretty quickly, but you will see some symptoms coming back, right? I always like to give an example with my son. We had body shaking, neck shaking, eye blinking, vocal tics. We had those vocal tics, and all of those went away, except the head shakes, the slight head shake. He would go like this. Even now he does that. So that's a clue to me that why is your PANDAS acting up? And then, I'll find out that he was eating at a restaurant 2 days in a row. Like yesterday's lunch and today's lunch was at a restaurant. Like, you can't do that, or after coming back from the restaurant, he forgot to do his detox. So, it's as simple as that. Now, I actually carry a daily OM blend and a detox spray in my purse. So when I eat at restaurants, because for me, muscle cramping is the autoimmune that happens because of the Lyme that I've overcome. And as Alexandra was explaining earlier, the adult PANDAS. So maybe that's what it is for me. That's what I'm suspecting that, because there's a muscle cramp that goes right down my back. It feels like crazy sciatica, and it stays there for days. So I have to be careful, because many times restaurants, they say gluten-free, but it becomes contaminated, inadvertently by one of the staff members. There's no guarantees. So I always carry the daily OM blend, which kills all the bacteria. It's very broad spectrum. And then the detox spray is always with me. I use that at the dentist office after the procedure. I use that in a restaurant after I eat. Is literally in my purse. So that's what Brian has it in his backpack at school. Sometimes he forgets, and I'll see his head shake happening. So, but it goes away within a day or two. I just increase the ISM blend, the immune system modulating blend. I increase the SS blend for a couple of days, and things go back to normal.
Thank you
Great.
so much.
You're welcome.
I've got here Simona Lungu with Marian, her husband. She's your patient.
Yes.
And they are asking if the muscle of her lung would be like not so strong anymore. It's just going over my head. Would it be treatable? And also, when can she get rid of the mask, the breathing mask?
Well, that is a very complicated question that needs to be answered at her appointment, is
Okay.
what I would recommend, right? Do muscles heal? Skeletal muscles, meaning striated muscles,
Yeah.
they heal faster, in my experience, than smooth muscles. Smooth muscles have a more complicated neurological association. So those will take, the body has smooth muscles and skeletal muscles, both kinds, and they are both affected many times for different reasons. Now, those reasons have not yet been identified for Simona.
Okay.
So we will explore that at the lab review appointment. And, by all means, stay in touch with my staff to make sure if your labs have come in. And if they've come in earlier, we can always, I don't mind coming in early to help out a patient, before my office hours. I do that all the time, or staying later. So if you want to expedite your appointment, that might be a possibility if we have received all the lab results.
Okay.
Okay, so yeah, muscle that is damaged. We need to find out why it's damaged. Right now, I don't think there are any answers available, right? I mean, the local doctors have given up.
Yeah, definitely. If there is someone else with another question. Mai are cineva o întrebare? Puteți să să traducem.
Yeah, actually, if I may, just one, I forgot to mention one thing. In labs, often I'll find one marker, right? So just a very small example, that when the body is full of toxins and multiple organ systems get affected by the toxin, something as simple as glyphosate affects your kidneys, your immune system, and the neurological system, right? Now, mold, it affects even more body systems, the liver, the gut, the brain, the immune system as well. So if these toxins add on in your body, they accumulate, they eventually affect the mitochondria in your cells. The mitochondria cannot work the way they want to work. It's called as hypometabolism, meaning reduced metabolism of the mitochondria. Now, what happens is recovery from anything in the beginning, it comes across as recovery from exercise is very slow. So what happens when you exercise? Lactic acid develops, right? Lactic acidosis. Now, lactic acidosis is seen in labs. Lactic acid is high. That is a major toxin for your muscle, and muscle contractions, healthy muscles, mitochondrial function, the energy cycle, they help to pump and clear out the lactic acid. Now, if lactic acid persists, meaning that your recovery is not as normal as it should be, that's when little by little damage starts to happen. Like if you pour acid over your muscle for a year, what do you think will happen? So this is a similar situation where, people just think, oh, today I'm just extra tired. Nobody really thinks about devastating issues like, oh my God, I have neurological involvement, because, GPs don't have that kind of awareness still, that simple symptoms that are persisting, not going away, need to be investigated quickly and fast, so that the treatment is possible. Unfortunately, it just takes a very long time sometimes to get diagnosed properly.
I think we've got Ramona.
Hello.
Hi, Ramona.
I have a question as well.
Where are you? Yes.
I had an EEG scan with my son. He'll be 5 in September. I had the EEG scan done 1.5 years ago. Because he had constantly stirring episodes, and he had the EEG scan. During the procedure, they cannot see any epilepsy, but they could see some abnormal moves, like I don't know, the scan, it was abnormal a little bit.
Okay.
And the doctor said most of our even us, we can have, when the EEG scan is done, we can have that abnormal in our brain, but doesn't mean we have epilepsy. I'm trying to understand, is this can affect the brain? Because my child, he still has like stirring episodes, not so often. He doesn't pay attention. Sometimes it seems like he doesn't hear us.
Yes. Okay.
Is not really concentrating. Indeed, he has some hearing problem as well, like blue ear, but I don't think it's always the case.
Sorry, he has a hearing problem?
He's
Like
got blue ear and several strep infections.
Yeah.
And
He's got ear infections and several strep infections. Okay.
And tonsillitis, if I'm not wrong.
And tonsillitis as well. Okay. So to answer your EEG question, Ramona, EEG abnormalities indicate inflammation in the brain. It may not be a full-fledged epilepsy, right? Now, when there is brain inflammation in the long term, obviously it is going to cause symptoms.
Like stirring episodes or...
Staring episodes, correct, yes. So I'm actually surprised if there are staring episodes, I would get a second opinion.
We actually just been discharged not long ago, like 2 weeks ago, because he doesn't have like episodes of epilepsy, like we cannot see anything.
Right. Like. So he's not having, any EEG changes, but if he is having absent seizures or staring episodes or quick blinking, I don't know, I would get a second opinion. But, here's the bottom line. Brain inflammation is the bottom line. So
he might have brain inflammation.
He has brain inflammation.
He has.
Can I also mention a link between Ramona and Mariana? They are sisters.
Yeah.
I see. Okay.
Okay. So, doctor, do you think you are able to help me with his case if I'll book an appointment with you?
Yes, I can help with full-fledged seizures, as well as, just brain inflammation, of course, yes. I mean, either or. I've had, children with many times, with many seizures a day, go down to nothing, many staring episodes or absent seizures, petit mal seizures. They greatly reduced or they completely disappear. Will depend on each child and how much damage has already been done.
Okay. Okay. So I'll try to book an appointment as soon as possible then.
Sure.
Thank you very much. Thank you.
You're welcome.
Thank you a lot for your time and all the answers. Greatly appreciated all the time.
Absolutely. No, I hope, it was helpful. I'm always here. If anyone has any questions, we can do another one. So let's see, there is Ramona, Mariana, Liliana, Dorina, Juliana, Christina, Mihai, again, Dorina, Florentina, there is Simone, there's Alina. I'm so glad you were here. I just wanted to say hi to everyone. And I'm glad you could join us. And you didn't have any questions? Well, maybe the questions were answered, but Good. I'm glad you were here. Thank you.
Thank you so
Alexandra.
much. I'm Jason's mom. Jason is a
Yes,
new
I know who
patient
you
from
are.
last week.
Yes, of course. I know who you are.
Thank you.
Thank you very much,
Okay.
doctor, and we'll see you maybe next time.
Absolutely. Happy to help and, take good care. I hope you will think about what I've said, watch it again, understand what is going on with your child. And, don't let anyone tell you this is it. There is always hope.
Thank you. Thank you, Alexandra.
That was the part 2, the final part of this podcast. Again, remember to watch both the parts so you understand everything that was spoken about, because there was a lot of scientific information, a lot of strategies that were spoken of. I always say that autism moms do some of the best research on the planet for their children, don't they? And don't we, is what I should say, because I'm one myself, right? Anyways, I'm so glad you guys were able to join me for part 2. And I look forward to seeing you at the next episode of Autism Uprooted with BioNexus Health. I'll see you then. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.